Today we'll discuss about one of the most important nutrients which is very essential for the body. Those are vitamins. So, before going into actual vitamins, let us see what is a balanced diet, or else what are the nutrients which are required for the body for a human being to be healthy. So there are various nutrients which are required for the body, like macronutrients and micronutrients. So macronutrients include proteins, carbohydrates, fats, oils, and micronutrients include minerals and vitamins. And there are other nutrients which are very essential for the body, like fiber and water. So proteins, what are the use of these proteins? So proteins, when we intake, they are very essential to help or build our body. In the sense, they are aiding in building of muscles, which give strength to the body. And the other one is carbohydrates. So carbohydrates are nothing but the simple carbs as well as complex carbs. In simpler words, we can say glucose. So glucose is one of the main essential carbohydrate which is generating energy in the body, because through a process called as glycolysis, glucose is converting to pyruvate, where it is further converted to give 32 ATP through the process of glycolysis. So glucose is very important, or else carbohydrates are very important in order to generate energy in the body. And the other one is fats and oils. So fats and oils, so they are very essential in building, or else we can say in establishing a proper plasma membrane. So what is a plasma membrane? It is a phospholipid bilayered membrane which is covering a cell. So each and every body, or else each and every human being is the unit, we can say the unit of the human body is called as cell, because our human body is made up of different kinds of cells. So each and every cell is covered by a phospholipid bilayered membrane which is called plasma membrane. So this plasma membrane is made up of these fats and oils. So without this plasma membrane, absorption cannot take place. So fats and oils also play very essential role in the body. And the other one is minerals and vitamins. So these are micronutrients which are very essential in small amount, but they aid in the proper health or good health of a human being. And the other one is fiber. Fiber is very essential, because fiber will aid in the movement of substances or movement of contents of the stomach in the intestine in a smooth way. So if whatever the food we intake, that will get digested and it has to pass through the intestine for absorption. So the movement of this food to go in a smooth way, the fiber will aid in it. And the other one is water. We know water is very essential to our body because it gives hydration to the body, or else it keeps our body in a moisture situation. So what are vitamins? So the word vitamin is derived from the Latin word called as vita. Vita means life. So when we intake vitamins, it will give life for us, that is a healthy, good human being. And these vitamins are nothing but these are the organic, or we can say the chemical compounds which are essential in very small amount to the body. So once they are available in very small amount in their particular sources, so we have to take these vitamins in a proper diet, then only it keeps us healthy. Vitamins. There are two categories of vitamins. One is water-soluble vitamins and the other one is fat-soluble vitamins. So water-soluble vitamins are nothing but which are soluble in water, and fat-soluble vitamins are nothing but which are lipidic in nature and they are not soluble in water, or we can say they are soluble in lipid contents. So these water-soluble vitamins are of two types again, vitamin B complex and vitamin C. And fat-soluble vitamins are of four types, vitamin A, D, E and K. So each and every vitamin has its biological role, each and every vitamin has its biological importance in the body. What are fat-soluble vitamins? So fat-soluble vitamins are nothing but these are the organic compounds which are soluble in water, but they need bile salts for absorption. So what are these bile salts? So in our body we have gallbladder, from which the bile salts are, bilirubin and bile salts are secreted out of that gallbladder. So these bile salts and bilirubin, they are very essential in the fat metabolism. So once these bilirubin and bile salts are released out of the gallbladder, they aid in the absorption of these fat soluble vitamins. So with proper absorption only these vitamins will work in our body, or we can say they'll have a proper function once if they are having proper absorption, and they are generally stored in the liver. So what does this mean? If the vitamins which are essential or else which are required in the amounts, they are absorbed by the body. So whatever the excess amount which is intake or whatever the excess amount which is present in the body, that is stored in the form of liver and it is utilized whenever it is necessary. And they are not excreted in the urine because they cannot be excreted in the urine as they are complex in nature. So, fat-soluble vitamins. So, these fat-soluble vitamins are of 4 types, A, D, E and K. But the biological, every vitamin has its biological importance. Now, we are going to discuss only vitamin D, E and K. What is vitamin D? Vitamin D is also called as calciferol, and this vitamin, it acts like a hormone in the body and it is not present in the body. It is synthesized from the sunlight. So when we expose to sunlight, from the sunlight body absorbs, the skin absorbs vitamin D, the skin absorbs the sunlight and through the sunlight the vitamin D is synthesized in the body. And this vitamin D is a rich source. One source is that from sunlight. The other source, or else we can say the dietary source of this vitamin D is, there are like milk, cereals, leafy vegetables as well as fortified milk, beef, egg. These all are few of the dietary sources of vitamin D. So here we can say the pictorial representation. So one thing, the vitamin D is taken through the diet, and once it is taken through the diet, it is absorbed in the intestine and then it is eliminated out of the body, or else we can say it is stored in the liver, and remaining whatever the absorbed vitamin is there, it is distributed via bloodstream and through sunlight. So our skin, what does it do? It absorbs the sunlight and there it manufactures or else it synthesizes the vitamin D in the body itself. So once the synthesized vitamin is there, after entering into the liver, it undergoes some sort of metabolic reactions. So what happens? Vitamin D is called as calciferol. So it is converted or else it is turned into 25-OH decalcidiol. What does this mean? So this calciferol or else this vitamin D is of 25 numbered carbon atom. So it consists of 25 carbon atoms. So on the 25th carbon atom, if hydroxyl group, that is OH group, is attached, so it is called as 25-OH decalciferol, and this is one of the, or else we can say it is the circulating vitamin D. Once it's converted to 25-OH decalcidiol or else calcidiol, then only it is circulated in the bloodstream. And the other one, once it is entering into the kidney, what happens? So once it is entering into the kidney, it is turned into, or else it's converted into 125-OH D2 calcitriol. So what does this mean? On first carbon atom as well as 25th carbon atom, the hydroxyl group is attached. As two hydroxyl groups are attached to it, we call it as calcitriol. Why? Because already one OH group, one hydroxyl group is present in the structure of the this vitamin D. So when one more is attached to that, we call it as calcidiol, and if two more are attached to that, we call it as calcitriol. So this calcitriol is or else we can say it is the active form of vitamin D. This is how the vitamin D is synthesized, and after this vitamin D is synthesized, it is aiding in the calcium absorption. So calcium is very essential to the body in order for formation of bones. So once if vitamin D is synthesized in a proper way, it is aiding in the calcium absorption. So once calcium is absorbed in a proper way, then bones will be formed very easily in the human beings. What are the other names, or else how this vitamin D is also called? So vitamin D is also called calciferol, or else calcidiol, or else calcitriol. And not only in the sunlight or dietary sources, it is also present in the animal source, or else we can say the vitamin D which is present in the animal, it's called as vitamin D3 or cholecalciferol. And if it is present in the plant sources, we call it as vitamin D2 or ergocalciferol. And it is one of the most important precursor of cholesterol in the body. So what is a precursor? Precursor is the starting material to the synthesis of any compound. So for the synthesis of cholesterol in the body, vitamin D is acting as a precursor, or else we can say it is a starting material for the synthesis of cholesterol in the body. Here we can see the structure of vitamin D. So it is already consisting of one OH group, hydroxyl group. So on first carbon atom and on 25th carbon atom, if the hydroxyl groups are attached, then the active form of vitamin D is formed. What are the functions of this vitamin D? So vitamin D, as I told you, it's very essential to the body and it aids in the calcium absorption. So this is one of the most important vitamin for bone growth. So if vitamin D, once it is synthesized in the body, it aids, or else we can say it acts in combination with other hormones or other vitamins. So if vitamin D, once it's synthesized in the body, it acts along with the vitamin A, E, K as well, and it contributes with other hormones like parathyroid hormones, which is parathyroid hormones are the hormones which are secreted from the parathyroid gland. So these aid in the calcium absorption, or else we can say they aid in the development of bones. So this vitamin D acts along with these hormones and vitamins, and it is very essential for calcium absorption in the body. So here we can see one of the pictorial representation where the protein function, or else how vitamin D is acting in the protein function. So here the protein, we can say the DNA, once the calcium, vitamin D is converted to its active form, that is calcitriol, it is aiding in the transcription of mRNA to DNA. So RNA and DNA are very essential, or else we can say they are the synthesizing material for a gene. So this vitamin D, it helps in the transcription as well as translation of mRNA to DNA, and once this DNA is synthesized, it is aiding in the synthesis of proteins. So not only the calcium absorption, it is also helping in the synthesis of proteins in the body, which are building the muscles of the body. Here one of the pictorial representation where we can see the hydroxylation in the kidneys. The hydroxylation of vitamin D is taking place where it is converted to calcitriol, and with the help of parathyroid hormones, it is getting absorbed. The calcium is getting absorbed in the intestine, and because of the absorption of calcium in the intestine, the calcification of bones is taking place. So this is one of the pictorial representation here. Because of the parathyroid glands, the parathyroid hormones, they are once entering into the kidney, they aid in the calcium absorption where calcification of bones take place. And all this happens only when the hydroxylation of vitamin D is taking place, or else only when the active form of vitamin D is formed in the body. Apart from calcium absorption and protein synthesis, vitamin D also have other roles or other functions, like it is aiding in the development of immune system. So immune system is one of the most important system in the body. So if a foreign particle or if an antibody or if a foreign particle is entering into the body, our body they release some sort of antibodies, or as we can say they release some sort of cells which invade those foreign particles and they remove out of the body, where they are helping in the immune system. So this vitamin D also plays a very major important role in the development of immune system, and along with that it is helping in the proper functioning of brain and nervous system. So vitamin D is also essential for the proper functioning of brain, then only proper signals and reflexes will be sent in the body. And apart from that, it is aiding in the proper functioning of pancreas, skin and various other organs in the body. So, next slide, what are the deficiencies, or else we can say vitamin D deficiency is caused by what, or what are the reasons for the causing of vitamin D deficiency. If a person is having dark coloration, or if a person is having darker skin, then he is exposed to vitamin D. And if a pregnant woman after the delivery, if she is giving a feed to the baby, then she has to be given with vitamin D supplements, otherwise she will be in deficient of vitamin D. And apart from that, if a person is not exposed to sunlight for longer period of time, then also he or she is exposed to vitamin D deficiency. And if a person is not consuming non-fortified milk, or else if he is using non-fortified milk, then he is exposed to calcium D deficiency. So what are the deficiency disorders? What happens if vitamin D is deficient? So it causes two types of disorders or diseases. One is osteomalacia and the other one is rickets. The most common deficiency of vitamin D is rickets. So what is rickets? So rickets occurs mostly in children. It is because of improper calcification of bones. So if bones are not properly calcified or bones are not properly formed, if proper amount of calcium is not present in the bones, then the bones become softened, they becomes brittle and they bend like a bow manner. So because of that, the bow mannered legs are formed in the children and this condition is called as rickets. And apart from that, sometimes it causes enlargement of feet. So in some children or in some cases, it causes the enlargement of feet as well as the enlargement of wrist also. And not only that, it aids in the lack of muscles. So vitamin D is essential for protein synthesis. So proteins are aiding in the building of muscles in the body. So if vitamin D is deficient, protein synthesis won't take place, and because of that, there will be lack of muscle formation in the body. And sometimes it may occur spasms in the muscle also. The muscles won't contract or relax and they remain in a constant state for a longer period of time. There occurring spasm in the muscles. And one of the most characteristic feature deficiency of vitamin D is disclosure of fontanelle. So in newborn children or in infants, we can see that there is a fontanelle or there is an opening at the frontal bone which is called as fontanelle. So if calcium D deficiency is there in adults, while growing, though that fontanelle will close and aiding in the proper skull formation. But if in the children is deficient of vitamin D, then the fontanelle will not close and thereby it causes some sort of CNS related disorders in the particular children. Here we can see the X-ray pictures of the rickets. Here we can see the bone is not properly formed, it is softened and thereby it is causing some sort of bending in the bones in a bow shape. And here the representation of the ribs, the pictorial representation of the ribs is showed, where the ribs deformity also takes place in the deficiency of vitamin D. This is a deficiency of vitamin D in children. So what happens in adults if vitamin D deficiency occurs? So vitamin D is very essential for calcium absorption. So in adults, if a person is suffering from vitamin D deficiency, it causes a condition called osteomalacia. So osteomalacia is a condition where the bones become brittle, or else we can say the bones are easily breakable, and thereby the person won't be able to walk or sit or do any proper work. Thereby it causes weakness in the particular person. And what happens if vitamin D is given to person in excess amount? So if anything which is given to in excess amount in the body, it causes toxicity. So even the nutrients, if they are given in excessive amount, it causes toxicity. So vitamin D, if it is present in excessive amount, it causes toxicity condition called as hypervitaminosis D. So what does this hypervitaminosis D means? So if this toxicity occurs, there occurs elevated blood calcium. So because of excessive vitamin D, it causes excessive calcium secretion, calcium absorption, and thereby the calcium levels in the blood will increase. So once the calcium levels or else calcium levels in the blood increase, they aid or else they add to the bone in excessive amount. If calcium is added to the bone in excessive amount, it causes calcification of the bones. So if calcification of the bones and tissues takes place, each and every soft tissue is replaced with calcium. So if the tissues are replaced with calcium, then the tissues become hard. If the tissues become hard, then it causes damage to that particular organ, which is very dangerous, or it may cause death to the human being. And apart from that, it causes frequent urination. So what are the doses which are given, or else what is the dose recommended for vitamin D? If a person is suffering from deficiency of vitamin D, then the dose should be given depending upon the age. So AI is nothing but adequate intake. So for the age of 19 to 50 years, the dose which is recommended or adequate intake of vitamin D is about 5 microgram per day. And if a person is having an age of 50 to 70 years, then the recommended dose or adequate intake of vitamin D is 10 microgram per day. And if a person is having the age of above 70 years, then the recommended dose is about 15 microgram per day. The other vitamin of fat soluble vitamin category is vitamin E. Vitamin E is also called as tocopherol. So what does this vitamin E, or else there are various types of vitamin E. There are mainly 4 types of vitamin E. That is tocopherol, that is alpha tocopherol, beta tocopherol, gamma tocopherol and delta tocopherol. See, vitamin E other name is tocopherol. See, it exists in 4 different forms: alpha, beta, gamma and delta. But alpha tocopherol is most commonly used vitamin E nowadays. So vitamin E, it is a major antioxidant. So antioxidant, there are various free radicals which are released in the body. So these free radicals, because of the oxidative stress and various other reasons, because of the free radicals which are generated in the body, it causes toxicity. So if vitamin E is taken in proper amount, it acts as an antioxidant where it is removing the free radicals out of the body and thereby preventing the person from toxicity. And this, how does this vitamin E is acting as an antioxidant? So it stops the chain reactions of free radicals. So what does this mean? There are free radicals, like for example, let us take a free radical called as H2O2, that is hydrogen peroxide. This hydrogen peroxide, after entering into the body, it undergoes hydrolysis process and thereby it is forming H2O minus, which is a free radical. So this free radical is very dangerous to the body and thereby it is causing toxicity. So there is some series of steps which are involved in the free radical formation. So this vitamin E, it blocks that, or else it stops the chain reaction of that free radicals, thereby removing the free radicals out of the body. And apart from that, there is it gives protection of polyunsaturated fatty acids and vitamin A. So how is this vitamin E is aiding in the protection of vitamin A? So vitamin A is a fat soluble vitamin, and this vitamin is very essential for the proper vision of the human being. So what does it do? It prevents the vitamin A to get reacted with polyunsaturated fatty acids, and thereby it is maintaining the vitamin A in active form. If vitamin A is reacting with polyunsaturated fatty acids, it causes inactive vitamin A where it is of no use. So this vitamin E is helping in, or else it is protecting the vitamin A in order for the lipidification, or else we can say in order for the vitamin A to get reacted with the lipids. And apart from that, it is protecting the oxidation of LDLs. So there are various cholesterols which are present in the body, that is LDL, VLDL, HDL and chylomicrons. So HDL is very good cholesterol which is essential to the body, and LDL, VLDL and chylomicrons are harmful to the body. So if these LDL, that is low density lipoproteins, if they undergo oxidation reaction, so because of the oxidation reaction, they form free radicals in the body. So these free radicals are very, very toxic to the body. So that is the reason this vitamin E is protecting the oxidation of these LDLs in order for the formation of free radicals. Here we can see the structure of vitamin E. What are the sources of this vitamin E? So there are various dietary sources of vitamin E. One of the main sources are polyunsaturated plant oils. So the plant oils which are polyunsaturated fatty acids, these are richest source of vitamin E. And apart from that, green leafy vegetables, wheat germ, whole grains, livers, egg yolk and nuts and seeds. So these are few of the dietary sources which are rich in vitamin E. Here, this is the pictorial representation of how this vitamin E is acting as an antioxidant. So here we can see R plus. See, R is a compound, or else we can say it's a xenobiotic compound. So once this R, let us take R as an example. So when R is undergoing bioactivation, because of the various bioactivation reactions, it is forming R plus free radical. So this R plus free radical is undergoing covalent bond because of the oxidative stress. Once it is forming covalent bond, then it forms various other free radicals also. Here we can see L free radical because of the oxidative stress or else because of the covalent bond which is formed in the R free radical. It is forming or else it is leading to other free radical synthesis in the body. So L is a free radical. Because of the oxidation of this L, LOO plus free radical is formed. So this, once it generates another free radical, then it is distributed all over the body, leading to toxicity. Before it is synthesized in another free radical, before it is involved in the synthesis of another free radical, here vitamin E is binding with that LOO plus, and thereby it is making that free radical inactive and it is terminated out of the body. So this is how vitamin E is acting as an antioxidant. Vitamin E deficiency. What happens in the body if vitamin E deficiency is taking place? So vitamin E deficiency leads to a condition called as erythrocyte hemolysis. So erythrocytes are nothing but red blood cells. So these red blood cells are very essential to the body, or else we can say they aid in the formation of blood in the body. So if blood is devoid of erythrocytes, then it leaves only a transparent fluid called as plasma, so which is of no use. So if vitamin E deficiency occurs, it leads to erythrocyte hemolysis, or else we can say the breakage of erythrocytes takes place. So once the erythrocyte is braked, then it won't function in a proper way and it is eliminated out of the body, and the lifespan of this erythrocyte is also only 120 days. So the synthesis of these red blood cells also have some particular time only. For this time period only RBC is synthesized in the bone marrow of the body. So once if the RBC is getting depleted, then the synthesis won't take immediately. So there is some particular time which is involved for the synthesis of RBC. So for every 120 days the RBC will die or else they get depleted in the body. Before that, if hemolysis of erythrocyte takes place, then there won't occur formation of erythrocytes, leading to various anemic conditions. For example, like hemolytic anemia. So this is one of the anemial condition where there will be no proper RBC count in the body, or else we can say the RBC count in the body is not up to the mark. So, what are the deficiency symptoms? So what are the symptoms we can observe if a person is having vitamin E deficiency? So if a person is having vitamin E deficiency, it leads to loss of muscle coordination and reflexes. So if a person is not having vitamin E in essential amount, then the contraction, or as we can say the reflexes which are occurring in the body, they won't, or else there will be lack of reflexes or there will be lack of muscle coordination in the body. And apart from that, the person will have impaired vision, because this vitamin E is very essential for the development, or as we can say the development of brains or central nervous system, or as we can say the nervous system development takes place because of the vitamin E. As it is also acting as an antioxidant, it is preventing the organ damage of various organs in the body. So one of the major important deficiency symptom is that the person will have impaired vision, as well as the person will have impaired speech, and apart from that there will be nerve damage, and apart from that there will be hemolysis of erythrocytes. Toxicity. So what happens if vitamin E is given, or else if vitamin E is exceeding its dose? So the vitamin E is required for the body in essential amount. Once if it is exceeding its baseline, then it leads to toxicity. So these toxicity conditions of vitamin E are very rare, but if vitamin E is having some excessive, or else we can say if vitamin E toxicity is caused in some conditions, it may lead to anti-clotting medication, or else the anti-clotting medications, the medicines which are used for anti-clotting, anticoagulants will be reduced, or the effect of the anticoagulants will be reduced if vitamin E toxicity occurs. And the daily recommended dose of vitamin E is 15 mg. The next vitamin E is vitamin K, which is also called as phyloquinone. And this vitamin K, the other names of this vitamin K are phyloquinone, menaquinone, menadione and naphthaquinone. So these names are given based on the forms it have. So vitamin K, it exists in three forms: vitamin K1, K2 as well as K3. So the names of these vitamins are given based on the existing form, or as the form of vitamin which is. If it is K1, we call it as menaquinone and menadione. If it is K3, we call it as naphthaquinone. So vitamin K. So how does this vitamin K is playing a role in the body? So in adult human beings, the bacteria which are present in the intestine, these are essential bacteria which are needed to the body. So the intestinal flora which are containing bacteria, they are aiding in the synthesis of vitamin D. So this vitamin D is aiding in the absorption of various other nutrients in the body. So this vitamin K, it also plays a major role in blood clotting. We can say it is a best coagulant. So if vitamin K is in proper amount, then it leads to proper clotting of the blood. So if a person is suffering from vitamin K deficiency, then overbleeding or hemorrhagic conditions can occur in that particular patient. And where does this deficiency takes place? So in the newborns, in the newborn children, antibiotics are given when they are born. So these antibiotics are given for the children in order to protect them from various microorganisms. But because of the antibiotics, the intestinal flora in the body of infants is not generated. If intestinal flora or intestinal bacteria is not present in the infants, then it won't synthesize vitamin K. So vitamin K deficiency occurs mostly in the infants. So this is the structure of vitamin K or phyloquinone. What are the sources of this vitamin K? So vitamin K is rich in, or else it is synthesized by the bacteria which is present in the intestine. Apart from that, it is present in various dietary sources, especially the leafy vegetables like cabbage and cabbage type of leafy vegetables. So apart from that, it is also present in milk and liver. What is the biological role, or what is the importance of vitamin K in the biological system? So it is aiding in the synthesis of blood clotting proteins. So if in order for a blood to clot, there are various factors which are essential. So these factors, if these factors are formed in the body or synthesized in the body, then only clotting mechanism takes place. So if vitamin K is deficient, then this clotting won't take place in a proper manner. So vitamin K is very essential in order for the blood to clot. And apart from that, the synthesis of bone proteins that regulate the body calcium. So in order for the bones to get developed, it needs calcium. So the calcium which is needed for the bone development, that will be helpful, or as the absorption of calcium can also be aided with vitamin K. What happens? The deficiency of vitamin K takes place. So one thing, if deficiency of vitamin K takes place, it leads to a condition called hemophilia. Hemophilia is a condition, or else we can say it is a blood disorder where clotting won't take place in a proper manner. If clotting won't take place, it leads to excessive bleeding, or else it leads to a condition called as hemorrhage. So the deficiency of vitamin K causes hemorrhagic conditions. And secondary deficiency may occur with the use of antibiotics. So as antibiotics kill the bacteria, once if we take antibiotics, even the essential bacteria which are needed to the body also killed, like intestinal flora. If these bacteria are killed, vitamin K is not synthesized in the body. And in new babies also, as I told you, they are given antibiotics, thereby the intestinal flora or bacteria are not generated, whereby there occurs vitamin K deficiency. That is the reason vitamin K supplement should be given to the infants or newborns. What happens if vitamin K is given in excessive amount? Or else what happens if vitamin K toxicity occurs? Mostly the toxicity are uncommon, or else toxicity is very rare with vitamin K. If it causes vitamin K, if a vitamin K toxicity is caused, then it leads to ineffectiveness of anti-clotting medications. So, or else we can say vitamin K is there in excessive amount or toxicity of vitamin K occurs, it leads to excessive clotting of blood. So thereby, if we give anti-clotting medications also, then there won't be no use, or else there won't be any effect of these anti-clotting medications. So, what are the recommendations or daily required dose of vitamin K? So, daily required dose of vitamin K depends upon the gender. So, the adequate intake of vitamin K in men is about 120 microgram per day, and the adequate intake of vitamin K in women is about 90 microgram per day.